This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Mon Health Talk for this Monday. Thanks for joining us. I'm Kyle Wigg, sitting in for Dave Wilson, who will be back around with Metro News Talk Line at 10 a.m. Mon Health Talk for this Monday, April 29th. And our guest this morning is Abigail Blake. She's a physical therapist that works with HealthWorks Rehab and Fitness. And Abigail, good morning. Thanks for joining us on Mon Health Talk.
Good morning. Thanks so much for having me.
First of all, explain the relationship between Mon Health and HealthWorks.
So Mon Health and HealthWorks are in a joint venture, which means that we really just work together to make sure that patients are getting the best care possible and have a really easy transition into rehab when they need it.
And your specialty, I know you're a physical therapist, but your specialty is pelvic health. First of all, give us a little background on you, where you're from, and what drew you to this profession and this specialty.
Yeah, so I'm originally from Lancaster, Pennsylvania, which is about an hour and a half outside of Philly. I did my undergrad at the University of Pittsburgh, and after that I was ready to be a little closer to home. So I moved back to Central PA to get my doctorate in physical therapy from Lebanon Valley College. After that, I worked in Central PA for a little bit before moving to Morgantown, where I'm now working at HealthWorks as a coordinator for the Corvia Pelvic Health Program in West Virginia and Western PA, and I'm also a treating clinician. So my husband is actually a WVU grad, and he was the reason we came on back to the area, and we're really excited to be here.
All right, so one half of the house is WVU and the other half's Pitt. Is that what I'm kind of getting?
It's a split household, but we're getting there. We're getting there.
That's great. All right, Corvia, you mentioned that. So that's something that's fairly new, and again, that is your specialty. So define Corvia for us, and how's it been going? It's a program that's been going for several months now, right?
Yes. So Corvia is a national pelvic health program, and really the whole goal of Corvia is to improve access to pelvic health physical therapy and make sure that our patients are getting the best quality of pelvic health care. So definitely in general, there's a lack of access to pelvic health. And we're really just trying to increase awareness and increase access. So all of the Corvia physical therapists are competency trained and assessed, which means that we are given, very specific education and have a course of classes that we go through and testing that we take to make sure that everybody's really up to date on the most important information, the most current information, so that you know that your physical therapists know what they're doing and you're getting the best care possible, which is really, really cool. It's a national program, so we have a lot of kind of access to education, and we're always on the up-and-coming stuff.
And I would imagine specialists like you work together, right? You get together, whether it be, in seminars or even over the phone or over Zoom with others that specialize in pelvic health, right? Share notes, that type of thing?
Absolutely. Across the country, we all actually meet even on a weekly basis, and we listen to talks, we have speakers come, we have education, and we pick each other's brains all the time to make sure that we're really all on the same page and everybody helps each other out all the time. So there's always someone that you can learn from, always new things to learn. It's really cool. It's great to be a part of.
And when you talk about pelvic health, you're talking about women and pregnancy, right? Incontinence issues for males and females, men that have had prostate issues. Am I oversimplifying that? What are some more aspects of it?
Yeah, absolutely. So pelvic floor physical therapy really incorporates the entire core, actually. So from the diaphragm sitting right under your ribs to the pelvic floor musculature, which is a sling of muscles that sits really low in your pelvis, but also the low back, the abdominal wall. So it really covers a larger area than I think a lot of people think. So we treat kind of anything in there. I treat, urinary issues, incontinence, urgency frequency, bowel concerns, constipation, leakage, pelvic pain. But like you mentioned, a lot of folks, pre-op or post-op, whether that's post-prostatectomy or from an abdominal surgery, postpartum women, pregnant women who are having pain. There's really kind of a wide range of things that we can see and treat and make sure you're getting back to your life as pain-free as possible.
So if someone's having back pain or pain maybe in their legs, or that could all be traced back to the core in a lot of instances, right? It may be something we don't think about.
Absolutely. And one of the big things we do is education and talking to patients about how a lot of times we think of the core, you just think of like your six-pack abs, right? But it's a lot more than that, and it really creates a pressure canister in your abdomen, which is what supports your whole body, and it gives you the stability so that your legs can do what they need to do and your arms can do what they need to do. And oftentimes in those other conditions that you may think are unrelated, they really do have a core and a pelvic floor component. So we really make sure to look at the person as a whole. I'm not only looking at those urinary issues or things like that, making sure that we look at the whole person and treat, anything that's going on, because there very well might be a pelvic floor or a core component.
Another thing with pelvic health, and I guess with incontinence issues, you automatically think about the Kegels, right? The Kegel exercise, and you've evolved so much more from that. The Kegels are important, but there's many, many other aspects, right?
Of course. And, some people, I have a lot of patients come in and they're doing their Kegels, and sometimes we actually have to tone that down a little bit. Sometimes that's, not what we need. Maybe you are really strong and we need to work on flexibility of the tissue or down training, relaxation, or just maybe, coordinating other things with them. So that's a big one that I see. A lot of times we got to downplay the Kegels a little bit too. So it's a lot of education, which is one of the things I really enjoy about pelvic health, is that it's not always just 100% exercise. Well,
with the Kegels, it's if you're not doing them right, you can cause additional damage or harm. So that's a big thing, right? You got to get them. You got to figure out how to do them right.
Absolutely, activating the correct muscle. Just like any other exercise, quality over quantity. So making sure that we're activating the correct muscles at the correct time, coordinating with breath work, making sure we're breathing correctly. It all goes back to that pressure canister. So making sure we're contracting when we need to and we're lengthening when we need to, which is really difficult. They're not muscles that we really think about too often. So that can be tough.
With HealthWorks, I know you've put an emphasis on prehab. First of all, explain that for folks that perhaps are, women who are pregnant and preparing for childbirth, men or women who are preparing for significant abdominal surgery. Prehab has become very, very important.
Absolutely. I think a lot of times, especially these days, surgeries can be so common and we really don't think much of them. But really, when you get down to it, that's a big trauma to your body. And it's really important to make sure that we're getting people as strong as they can be and as effective with their movements as they can be before the surgery, because we know there's going to be a little dip in function. You're having a pretty serious trauma to your body, so that when that does happen, when that dip does happen after the surgery, you're starting from a much higher point. So we can keep people as active as possible, as, able to do their daily activities, get back to work faster. It really just overall kind of makes your recovery a whole lot easier, a whole lot faster. So it's really, really important to get in beforehand if you can.
So the prehab works on strength, right? It works on flexibility. What are some other things?
Yeah, strength and endurance, flexibility. A lot of times we'll have people work on jobs or tasks that are specific to what they might do throughout the home. Especially a pregnant mom. Well, let's work on lifting mechanics for when you have to lift that baby in and out of the crib. Let's work on, posture so that when you're sitting feeding the baby, you don't end up with back pain. And for, abdominal surgeries, working on getting that core strong, working on making sure you have the flexibility elsewhere to do what you need to do when maybe we have to adjust things. You're not getting out of bed like you were before. You're not carrying things around like you were before. So really just a lot of teaching people how to kind of alter their movements to protect the area and how to make sure you're getting back to function faster.
This is Mon Health Talk on WAJR. We are visiting with Abigail Blake. She's a physical therapist with HealthWorks Rehab and Fitness. And Abigail, again, with the prehab, I would imagine this is one of the ways that HealthWorks and Mon Health are tied together in a sense that I'm sure you get a lot of referrals for folks that are, headed for probably some significant surgery to kind of get that prehab, get those things, get that strength and endurance up before the surgery comes.
Absolutely, absolutely. And it's really great that we have that partnership because it's so necessary to get people back to their function earlier and more effectively. And so it's been really great to have that partnership with Mon so that we can serve the patients better. And really that's what it's all about.
Mon Health Talk Radio for this Monday. We'll take a break. Again, Abigail Blake, physical therapist with HealthWorks and Rehab, our guest. We'll take a break. We will continue the conversation on Mon Health Talk after this.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Mon Health Talk continuing for this Monday. Thanks for joining us. Abigail Blake is our guest. She's a physical therapist with HealthWorks Rehab and Fitness, and her specialty is pelvic health. And we've talked a little bit about Corvia, and we'll talk perhaps more about that as time permits. But Abigail, what about folks that, trying to be proactive about their pelvic health? What are some things you can do to kind of keep that area active and strong and stretched out?
I think the biggest thing in general is really just, being active in general, making sure you're getting those recommended 150 minutes of aerobic exercise in a week, making sure you're getting those big body systems moving and strong, and really just kind of being aware. I think that's the biggest thing is pay attention to your body and start listening to your body. The biggest thing I notice is that people say, well, this all started, this pain or these symptoms years and years ago, and I just kind of thought it was normal, so I never do anything about it. They come on slowly over time, but it doesn't have to be like that. So just paying attention to your body and then reaching out for help when things are getting a little funny or they're changing or you start having symptoms. The earlier you reach out, the faster we can get you help.
Now, incontinence issues, again, this is something that people may have been living with for years and years and years. Do you have hope for some folks that maybe are dealing with incontinence, or are there some things that you can help them with to try and make it better?
Oh, absolutely. I see people all the time who have been dealing with this for years, and little by little, they kind of stop doing the things they love. They stop jumping around or exercising or playing with their kids, and there's always hope, and there's tons of things that we can do. Exercises, learning to kind of alter maybe your movements or your breathing patterns to get you back to doing the things you want to do. But there's definitely always hope and always things that we can work on to get you back.
Now, incontinence I would imagine, be the number one symptom or one of the top symptoms, but what are some other things that people need to look out for as an indication that they may need some help with that core or with that pelvic floor?
Yeah, really any changes to your bowel, bladder, or sexual function. Often the bowel changes, the bladder changes are what people notice first. But even changes to your balance, back pain, hip pain are things that people might start noticing, or they may even cluster together a little bit to tell you that kind of something's going on in that core pelvic floor area, and maybe you should reach out to your physician or reach out to a physical therapist for help.
And again, Corvia, that's your specialty, and that's something that you've worked on a great deal upon. What are some things that have just come in the last 6 months to a year? Some advances. That's the word I was looking for. Some advancements that you've learned, that you've put into practice just recently.
Most recently, we've been doing a lot of work with men's pelvic health, and I think that's an area, even of pelvic health particularly, that's really underserved. So things you don't think about, prostatitis, male pelvic pain, we don't hear about those things as often as we hear about maybe incontinence or things like that. So we've been doing a lot of work in that arena, taking a lot of classes, meeting with the experts, and really figuring out the best way to take care of that. It's interesting, a lot of those things, like I said, we think about the core as a whole, and they actually can be coming from your back. There's a large percentage where it's working on the back makes a big difference as part of the core. So that's been really, really cool to learn a lot more about and put into practice.
Okay, if you're listening out there and you want to learn more about ways that HealthWorks can help you with your pelvic health and with that pelvic floor. Where can people go to learn more?
So for more information, listeners can go to healthworksrf.com and click on Corvia Pelvic Health, or you can always call into HealthWorks Morgantown at 304-599-2515, and I'd be happy to answer any questions.
All right, so if you have an issue in terms of this, whether it's incontinence or pain or preparing, I mean, this is really important, the prehab. If you're preparing for perhaps childbirth or a major surgical procedure, get out in front of it, right? I mean, that's one of the things that you want to encourage people the most, right?
That's the best thing you can do is kind of get ahead, get yourself strong, get yourself prepared, and then we'll do our best afterwards to get you back to doing what you want to be doing.
Very good. Thank you. We appreciate your time. Abigail Blake, physical therapist with HealthWorks Rehab and Fitness, working in conjunction with Mon Health. And again, Abigail, great information. We appreciate your time, and we'll talk to you again.
Thank you so much.
Abigail Blake from HealthWorks Rehab and Fitness, a specialist in pelvic health. And that's Mon Health Talk Radio for this Monday. Thanks for listening on WAJR.